right now I'm going to go ahead and start the program and bring on Dr. Michelle Garcia, who's a licensed doctor of psychology here in the greater Houston area, and she'll provide her presentation. So, Michelle, you're on.
All right, thank you. I'm Dr. Michelle Garcia, and I'm as you said, psychologist. The reason that I'm really talking about this subject, and I'll pull up my presentation here in a minute, but the reason that I'm talking about this subject, besides the fact that we all know it's extremely important, is probably about 12 or so years ago, I was commissioned by the ARC up in Pennsylvania to write a curriculum because we know that there are situations happening both within individuals in school age as well as in adults where they are ending up either being victimized or in the criminal justice system. And so, after doing a focus group up there in Pennsylvania and writing curriculum, it was piloted in their largest two school districts. Um, we took the feedback from there and then tweaked the program. And just in the process, wanted this to be something that was completely different. As the program kind of went on, I ended up linking up with an organization called D3, which I'll talk about in a few minutes. But they support people who end up in the criminal justice system and their family. And then also with an amazing attorney out of New York, Mark Mahoney. If you want to hear some amazing information about autism, look him up. He has some different presentations that are out there to be found on social media. Um, and so, in the process, what I've learned, unfortunately, is how important sex education is. Now, of course, we live in Texas, so we can't really use the word sex education. I mistakenly used it at an MDR not long ago and was told we're in Texas, we don't do that. Sexual health, family life, whatever we need to call it, but this subject is extremely important. So I'm going to go ahead and start. Let me um, get this going. All right, there we go. All right, so we, as I said, are going to talk about the importance of incorporating this type of education into the IEP. So first and foremost, when is it important? Well, here in America anyway, girls are hitting puberty around the age of 7 to 14, and boys between the age of 12 and 18. Again, these are general numbers, but because physical development is occurring at that time, and the beginning of sexual development, it's important that we're talking about the education early enough, which of course we know is not really happening. But it's extremely important. Even though we have individuals that we work with who may have varying mental health or cognitive disabilities, social disabilities, we know that their bodies are developing the same as their typical peers. So, often the person has a desire to express their sexual feelings. They have confusing, not understanding what is going on with their body. They may have urges or, different physiological sensations and not really understand what to do about it. And it can, of course, as we know, occur during the course of the school day because it's not always in the control of the person. And so, how to manage those feelings and what's going on with their body while they're at school. The person can experience anxiety. And again, as we know, they have differing levels of understanding their changes and feelings. I can't tell you how many times I've been told, especially with autism, oh, well, they know and they understand or they're able to say this or that. And therefore, surely they must have the understanding of the fact that this exposure or this masturbation in a public setting or whatever it is, They know that it's wrong because they're able to verbalize certain statements, but we know that in reality, their understanding of social language and use of language is not always the same as what is going on. And so we have differences in ability to understand or ability to adjust behavior. That's the other thing. So a lot of times for people with differences, they may have these experiences in, let's say, a home setting, but now we've got to generalize it to the school setting. And how do we do that? Because generalizability is not something that's necessarily natural for people with disabilities. It's something that absolutely has to be taught. So, there may be one expectation at home and a different expectation at school, a different expectation in the community, a different expectation in one class versus another, or in the bathroom versus in the classroom. And so we really have to make sure that we're taking all of this into account. Why is it important? I started to talk about it. But, we know that people with differences in learning have differences in learning, meaning that we need to do more education, we need to do it differently. So what we actually find, and I didn't put it in this presentation, but is the more severe the disability, the less education they're actually getting, which is the opposite of what needs to be happening. The more impacted the person is, the more education that the person needs. And we have to do that in a multitude of different ways. We've got to look at multimodal, we need to look at data driven, but we know that the person needs more education. They often learn at a slower rate. So doing the one and done that our school districts often do is just not enough. We know that the person has communication issues. So again, just because somebody can parrot back what they've heard doesn't mean that it's sunk in or able to be applied. So there's a communication issues, both receiving and relaying information. Limited literacy, and difficulty with abstract thinking and comprehension. So again, looking at the concreteness of what are we teaching and are we using abstract ideas with it? Because this person may not be able to take what they're learning and abstract, how does this apply to me, or how does this apply within my classroom, or what have you. We know that the person often has trouble relating the ideas to their own life experience. So if we're not making it personal and we're not giving a chance for this to be interactive and something that is engaging, then the person may not be able to apply it. And I talked about this already, but generalization has to be done specifically for people with differences in learning. It can't just be assumed to take place. Here are some other more critical reasons. So, people with disabilities, as we know, have, just as much of a chance of STIs and unplanned pregnancies. We know that a lot of this information is out there on social media. So the people, individuals are getting exposed to it. I can't tell you how many times I've been in a situation where I'm interviewing an individual who has now interfaced with the criminal justice system, and they've heard things around the school. They've heard peers talking. They've seen things on social media. They've been curious and looked things up. And so they're getting this exposure to it, but they don't fully understand it or know what to do with it, or know the pros and cons, or the ins and outs, or the legal implications, or the risk factors. I had an individual who ended up getting exposed, unfortunately, in a treatment center. He was an adolescent, and he got exposed to sexuality and pornography while he was in a treatment center. And that was the only exposure that he really had. And then as he got older, he was around peers who were the same age or even older, who were in dating relationships and having sexual relations. And because of the exposure that he had and his awareness that he has a disability, he felt like he was never going to be able to accomplish having sexual intercourse with another person. And so as an adolescent, he went on social media and found somebody And in the process, it turned out this person was an adult prostitute. And so that was his first experience with what he thought was a relationship. And again, because of his autism, he didn't understand that this wasn't a relationship. So he paid, but I mean, he was exposed through peers and media um, and so, he just didn't have the education that he needed to counter that information. We also know that individuals with disabilities are at increased risk of sexual harm because of the lack of knowledge. So I often hear caregivers, will talk about the importance of this type of education, and caregivers will say, well, I don't want to talk about it with my loved one because oftentimes we want to keep individuals in a bubble. But it's actually this lack of education, the lack of knowledge that puts people at higher risk. We know that for, all individuals, for children, they say a lot for the children and people who know the correct terms, that if somebody is trying to groom them or, abuse them, that it's less likely to happen because they realize that they're able to use appropriate terms to say what's happened to them. So we definitely want to make sure that we're providing adequate and accurate information. We know, again, misinformation from peers. I think that happens for everybody, whether you have a disability or not. We know that peers don't really have the right information, but being able to tease that out and understanding that they don't. We know that people with disabilities are at an increased risk of dependence on others for assistance, that a lot of our behavior plans, we teach compliance. Caregivers, we teach compliance, teachers teach compliance, but unfortunately, that does put individuals at risk of being abused. We're not teaching assertiveness training, the fact that it's okay to say no, that it's okay to say yes and change your mind and say no, um, or stop, those kinds of things. And so, we need to be doing more of the assertiveness training. And of course, I talked about the bubble that we often try to keep people in. And unfortunately, this overprotected lifestyle and limited social contact then puts the person at significant risk of sexual harm. Even more so, why is education important? There is now an increased risk, and I say now just because, we're more aware of it than we were before, but there's an increased risk of criminal justice involvement. We know that there are statistics that say that there are a lot of people who are in the criminal justice system who have autism and other disabilities. And why are they at risk? A lot of times, and we'll talk about this, but a lot of times they're at risk because they're not getting the education and they don't know how to decipher their feelings, their urges, what they're taking in through social media. And, again, as we know, they're more likely to get caught because of the language barriers. I've watched too many interrogation videos where the detective is saying things like, oh, you can talk to me. You don't need your parent there. You don't need your lawyer there. You're an adult, right? You can talk to me. I mean, just tell me you like this, don't you? And just really egging it on. It's pretty disgusting stuff to watch. But it is happening. And unfortunately, because of these language barriers, we have people that are saying things that they don't understand the implications of what they're saying. And they're agreeing because of the compliance and who they're talking to things that they don't necessarily mean or that they don't necessarily feel. And so, some of the things that again lead to a very significant need for us educating at a young age and little by little over time, there are now these sting operations that are going on where the police are trying to catch, we'll say bad guys, but unfortunately they're casting these huge nets and using innuendos to try to get people. So what they're doing is they're saying things like, well, I want to meet up with you, but I have to wait for my mom to get home. Or I want to meet up with you, but I have to wait till I get home from school. because a lot of the individuals we work with are in school till beyond the age of 18 or even at the age of 18, because adults often live with their family members, they don't pick up on those differences. And so it's not until they are on the way to meet each other that the police will then say things like, oh, by the way, I'm 14, does that matter? Well, at this point, as we know, individuals with disabilities have a hard time regrouping and changing what they're doing. And so they're not able to wrestle with this confusing information. They've exchanged pictures, the person looked like they were the same age. And so what do we do now? And so they show up and they end up getting arrested. Or we've even had situations where the person says, no, I can't talk to you because you're underage. And the police keep goading them. Oh, it's okay. I do this all the time. It's, not a big deal. And, they really push and push and push and push and push until they capture some of the individuals that we work with disabilities. We know because of the social delays. I had an individual up in another state where he was, I think, 19, maybe 18, 19, and had met a girl through work, so through coworkers, and she happened to be under 18. But because of the social delays, they really hit it off and connected, and their families were okay with the relationship. They were knowledgeable of the relationship, but the couple, being teenagers, decided to park their car and have some relations in a neighborhood. And so police came over because somebody called the police. And even though the girl said, this is consensual, I'm consensual, they still, because he was 18, they still arrested him. And he had to deal with a lot of different legal implications. Also, we know, of course, that there are people who are 18, 19, 20, 21, 22 who are still in school. And they're in school with, people in ninth grade who are quite a bit younger. So really, we need to be teaching these things because it's extremely important because of those social delays. A lot of times the individual may connect best with somebody who's younger. We know that we need specific education and to teach the different rules. We need to teach about online engagement. We've got lots of people. I have several individuals who were teenagers and they were learning about their own sexuality. And so they sought pornography. They were exposed to pornography or told about pornography. And so as an adolescent, they were on pornography, looking at different things to explore their own sexuality or just to learn about the body in general. I have another 12-year-old that was possibly going through precocious puberty, and so the parents did all the right things and, went over puberty with him, taking him some books and going over the right terms and showing pictures. Well, unfortunately, because he is going through puberty and starting to develop sexual feelings and had then a special interest in body parts, he was looking at everything he could find having to do with the chest and the penis of people. And so he would look at mannequins and he would start to look up things online or ask other kids in his school if he could see their chest. So, again, people go online or natural curiosity. And, because of these disabilities and the delays, they don't understand the ins and outs that they need to know. The same with sending and receiving pictures. Unfortunately, as people are online, they can be groomed or, just in the course of back and forths with different individuals, they may receive pictures or send pictures of themselves. And so, really talking about that. Because as we know, if an adolescent sends a picture of themselves or receives it, that is, child pornography and distribution and can get them in a lot of trouble. So we need to really look at that. Exposure and comments, again, without understanding. And then we have victim becomes offender issues. So, you may have somebody who has been a victim and they now become, kind of a offender, but really a lot of times what we're seeing is they're just duplicating what was done to them and they don't really understand it or know that it's a negative thing to do. The other thing we see going back to curiosity is because of the social delays, sometimes individuals may be doing the typical exploration of the body, and doing it maybe with somebody else. Um, and that's the kind of thing that usually goes on in early childhood, but because the person is socially delayed, they may be going at it at a time when chronologically they're older. And so I've seen juvenile cases where they get in a lot of trouble because, the other child goes back, tells parents obviously concerned about what's going on, goes to the police, and then you've got police involvement for a child that really didn't understand that what they were doing was wrong. So we really have to talk. But what happens, we're all here because we know, but what's happening in the school districts instead? It's being treated as discipline. I mean, surely the person must know better, and surely it must be sexual in nature. And, you know, as I say, just because the person can maybe walk and talk like some of their peers doesn't mean that they don't have an invisible disability that changes things. And so it's treated as discipline. I was just at a MDR not long ago where this was the case. And so, it was deemed, unfortunately, that it was not due to the disability, but it clearly was. Or the phrasing in the discipline records refers to sexual in nature, even though it's not. So, the schools are unfortunately treating it as discipline. They're writing, so instead of education, when somebody engages in a behavior, they're writing it as a goal to change the behavior and as a consequence, but they're not filling in the gaps. They're not talking about, well, what education, what supports, what proactive things do we need to do to support this individual through their IEP? And again, as I said, there's limited supports, because oh my goodness, it has to do with the body. And so we can't possibly have that going on in the school system. And so we're not providing the supports that are needed. And as we know, the schools also, can and have called, the police, or child protective services. And so it can lead to legal problems for that individual, even though, again, they aren't getting the supports they need. They're not receiving the education. They're not having appropriate interventions and teachings in their plan. And so they're being penalized and possibly now a juvenile with legal charges, which is really sad. So, what are the main issues? And I've talked about this already. There's a lack of understanding of the wrongness or the impact of what the person's doing. And we need to remember that a lot of times for people with different disabilities, whether it's autism or an intellectual disability, that if we really look at their social understanding, for people with autism, the statistic is it's often a fourth of what their chronological age is. So you may have somebody who is, let's say, 16, who can, sure, their principal says, well, this is wrong, right? I mean, you're not supposed to show your body in the classroom. And the person can say, yes, yes, I know it's wrong. But if we're looking at somebody who socially is like a 4-year-old, I mean, I know that my 7-year-old, when he was 4, 5, 6, and now 7, can tell me, yes, I know it was wrong that I had candy when you were gone. But does he really understand why? Does he truly understand the wrongfulness of what he's doing or the impact, the greater impact that showing a penis in a classroom can make, or, those kinds of things. So, we really have to look at that and educate our schools about the fact that they don't really understand the impact or the wrongfulness. So the things that we want to target are, a lot of times these behaviors occur in the wrong place. So maybe somebody who doesn't communicate verbally is having a physiological urge and they engage in masturbation in the classroom. So, the masturbation itself is not the issue. The issue is obviously we don't want somebody masturbating in a classroom. So it's teaching the fact that this is a wrong place. So we need to teach place. We need to teach private. We need to teach public. We need to teach private and public behaviors and use an ABA-esque model, with reinforcement and cue cards and different things, but we need to teach that. Or you may have two individuals that are in class together that have a dating relationship and, they want to be together in the hallways or in the bathroom or in the classroom. And so, again, teaching that this is just wrong place. The same thing with wrong time, wrong place, wrong time, that this is just not the time to be engaging in these behaviors. Wrong person. So, maybe it is that, and, this goes into the non-consensual, but maybe somebody is attempting to have relations with somebody who's not interested in them or not able to give consent. Um, and by that, I mean that they are maybe not able to communicate verbally or they're not fully understanding what the other person's intentions are. So, trying to help educate on things like sexual harassment and, what the words mean and how they can be perceived. And that, it's okay to let's say think somebody's attractive and it's okay to look at them, but it's not okay to stare at them. That, you have to kind of look and look away. And, it's okay to say hi to the person and it's okay to try to be friends or to get to know them if you're interested in maybe one day dating. But you have to see what their feedback is. Are they interested as well? Are they, showing the nonverbal and verbal communication and teaching the person those social skills? Harm to self, obviously, that's a big issue. We want to make sure that people are safe. And, we've had situations ourselves because we do go out in the community as well, where we've had individuals that have harmed their bodies doing masturbation practices. So, not right now, but at some point, if you look up urethral sounding, we have had people that have, utilized sharp objects and inserted them into themselves, causing a lot of damage and pain. So, kind of looking at things obviously that are harmful, we want to make sure that we are targeting as well. And then, of course, there's online, so things like pornography. I'm sure you guys are aware, I'm sure that I'm preaching to the choir, but I can't tell you how many caregivers have said, you know, they are sitting in a class, my loved one is sitting in a class, and they are doing this assignment online on a computer, on a laptop, and there's no security on that laptop. And so they venture off into YouTube, into pornography. I have had individuals that access pornography at school, on tablets, on laptops. I actually know somebody personally whose son was able to take the teacher's phone to the bathroom and access pornography on a teacher's phone. So again, we really need to look at what we're doing because there's not a lot of monitoring and securing of what goes on online. And we've had individuals who have been in trouble with the criminal justice that have said that they've looked it up at school. So we need to be looking at that and talking about what's online and, all of the child pornography and pornography in general, but also information that's online. And, online goes into social media as well. So, that we have people who are hooking up or connecting, trying to become friends on social media. Um, and, it may be two adolescents that are connecting on social media. It may be an adolescent and an adult. But we certainly need to talk about it because people are, as I said, being victimized as well as ending up in the criminal justice system because of this social media connection that's happening. And then texting, again, I've talked about people texting pictures, and, of themselves. Um, Sorry, I just realized there was a Q&A, so I was opening that up. Um, I'll mention that in a second. But yeah, with the texting, people they're sending pictures, they're getting peer pressured into doing it. They're taking pictures of other people and then, it gets sent off. I know another person personally whose daughter, was sharing pictures of themselves and, the police did get involved. So, again, we really need to be talking about that. And somebody mentioned the dangers of Roblox. Absolutely. There's, um, I mean, everything online. Discord, I know there's groups, there's Dungeons and Dragons groups on Discord, but there's also a lot of sexual groups on Discord and, we've had situations. I had a therapist who was meeting with an adolescent, and they were on the video game sites, on, let's say, and obviously I'm not on them, so I am not able to talk super with their appropriate language, but they are on, these video games where they're in and they're talking to each other, and somebody went in there and said, "Hey, it seems like you've had a bad day. I'm a therapist. Do you want to come over in this private message area and we can talk more?" And so, that adolescent, I think, did in that instance. But, there's lots of things that happen. I have an individual that I've worked with for years and years and years. And when he was in high school, I mean, he would swear that the people he played on Xbox Live with were friends of his, even though he had never met them, and that everything they said was true. So, it's really, really scary. And then it says access to unapproved sites on the computer security. Is that the student's issue or the school's security measures? I mean, I think it needs to be the school's security measures. I think schools need to take some accountability and responsibility for the fact that students are able to access pornography and different things there. Now, obviously, I've had parents who have requested that their child um, not have access to the internet at school. I know schools kind of balk and say, well, how are we supposed to get these assignments done? And these were educated parents who also, advocate for people and do IEEs. And so, they were able to say, well, not really my problem, but there's been issues and so they can't use the computer. You'll have to figure this out. But I definitely think there needs to be a lot done there. So here is a positive thing. So sexual health and can it be done? Yes, yes, it can. In March 6th, 2020, Virginia approved the House bill putting sexual health education as part of their IEPs in K through 12 that's developmentally age appropriate with the goal of providing education to prevent future persons from getting caught up in the criminal justice system or ending up being victimized. So I have here the ruling. We were fortunate in that we were able to help write the ruling and it got approved. And there have been some people who have been able to do it. What they did up there, which I thought was really smart and something that we could look at here in Texas, is they used, and we did this in Pennsylvania as well when we piloted it in the schools, but they used the health teaks, I'll call them, and they would just mirror, okay, so, for health, we need to cover this. This is how we're going to do it. And so they would utilize that same educational language in offering those IEP goals. So, they said it's gotta, be data driven. It needs to be age appropriate. It needs to cover sexual health, self-restraint, self-protection, respect for personal privacy and personal boundaries of others. So it passed. And again, I think obviously there's a whole lot of work that needs to be done to get this to pass in other places. If anybody's interested in how it passed or any of the other amazing laws that have been passed in Virginia, Brian Kelmar is the guy to know. He's with D3 and it's the letter D and then spelled out THREE, and I believe it's .org. But he's the one that helped write this and got it to pass, and has done a lot of really good work up there. So, we really need to take heed and try to get this here, and really nationally. This is a huge epidemic that needs to be looked at. So how should it be done if we're going to do it? It needs to be data driven. I always say that, obviously there are a limited number of data driven programs out there, but if nothing else, they need to have a program in place. If they're going to write it, then it needs to be based on the goals for the person. It needs to be based on education, not just consequences. And they need to take data on whether or not just the person can recite it, but whether they can generalize it and use it, and not just for a week or 2 weeks or a month. Oh, yeah, they used it for a month, but now they've had this issue and we're going to, call it discipline. A month is not enough time. So, we really need it to be data driven over a long period of time. We know that we need to teach at the individual's level of understanding. So, looking at that, gauging what the person already knows. So, speaking from that place. So there's always the caution of not saying too much too early and not saying or saying not enough, I guess, too late. So, it's finding that middle ground so that we make sure, but this is why it needs to be a long-term approach and not just a reaction. It needs to be a proactive approach, for individuals. We want to use cues like turning into an adult or things that the person will understand. We do want to mention gender differences, and differences in bodies. We want to use visuals, visual cues, social stories, books, diagrams, videos, make it multimodal. We want to make sure that the language is specific and factual, using appropriate medical terminology. I'll never forget, we went to go, as the pilot was getting started, unfortunately, the teachers were not told in rural Pennsylvania that they were going to be teaching sex education. So as we got there to do the training, they were just flabbergasted. And so one lady said that she, in talking to her daughter and explaining puberty and things, that she talked about her daughter's vagina as a cupcake, is what she called it. So, we kind of chuckled and said, that's going to be a problem at a birthday party and in a lot of other places. But we need to make sure, that we are having teachers and BCBAs or whoever, diags, whoever's going to be doing this education, they need to be comfortable using appropriate terminology. They've got to be comfortable talking, because if they're not comfortable talking and giving the education, then it's not going to work. And I didn't put that in here, but that is obviously a big thing in using that language. Checking understanding, and that doesn't mean can the person parrot back to them what they've said. It means, does the person understand? Can they apply it? Can they use it? Can they role play? Those kinds of things. And discussing it multiple times and having a point person that they can go to for questions that they feel comfortable. What are the things that should be taught? This is just a sample. Public versus private, language, body parts, settings, clothing, different body parts, the reproductive cycle, hygiene, menstruation management, assertiveness, rights and responsibilities like consent, age of consent, behaviors of concern, sexuality, masturbation. I know that's a big thing. The school districts, again, they, don't love hearing that, but you've got individuals who are masturbating who don't communicate verbally, or, who are touching their private parts of their body, their penis, their vagina in public, in a classroom. We can't not talk about it. So we have to at least be able to talk about private behaviors and safe behaviors. Self-esteem, so peer pressure and, how that impacts. Expressing feelings, where to do it, how to do it, who to do it to. different types of relationships, in and out of relationships, because as we know, when we're talking about people, school age, I mean, they see the same people 5 days a week. They tend to be in the relationship, then out of the relationship, and back in the relationship. So we talk about all the different types. Social skills, so general social skills related to this, personal safety, coping with relationship difficulties and rejection, and sexually transmitted infections. This is just information about the program that we wrote. It is, like I said, it was commissioned by the Arc of Blair County. It was piloted in 2 school districts up there. It was used to write the bill that got passed in Virginia. The goal is to keep persons with differences safe from victimization and from entering the criminal justice system. It's data driven, so we take data to show that it improves knowledge. I'm not allowed to say it because of my license, but Mark Mahoney, who's an attorney in New York, does report, he did a study, a 10-year study, and reports zero recidivism for people who take a program like this that have had an interaction with the criminal justice system. I'm currently working with the University of Virginia and D3, which is Brian's organization, on a study looking at prevention of, this type of program using for prevention of entering the criminal justice system. Our program has been nationally recognized. There are 3 levels of ability, from people who don't communicate verbally all the way to people who don't have a cognitive difference but maybe have autism and a difference in learning. It's 16 chapters of information, multimodal. We are now associate sex offender treatment providers, which I do want to mention. We do have individuals that are getting into trouble, adolescents and children. And so if they need a program, if they need education, we can offer that. And we offer it as autism experts, as disability experts, so that we can do the teaching that they need instead of them going to these awful programs, otherwise. So able to offer diversion from incarceration or from, legal ramifications. It is virtual, so people across the nation can take it. We do also offer a train the trainer model, and we do have a model for teens and adults. Here's just information about me and my practice. We do testing, behavioral intervention, counseling. We run peers social skills groups and have our curriculum. And then I also do some free consults with families to provide different resources, which is oftentimes a lot of your information, because I often have people that think the school districts are providing the supports that their children need, but when I look at it and I talk to them, they're in fact not. So I'm often sending them advocates information so that they can get the help they need. And that is it. Any questions? Will we receive a copy of presentation for reference? Lou, that's a question for you. How do I do that?
Actually, that would be an answer for Robin. There's some more Q&As coming, and then I'll have one here.
So yes, I'm happy to provide my presentation.
Um, okay, I have a question. Um, in Texas, obviously, or anywhere, I suppose, as you mentioned, is the easiest thing is to tie it to the curriculum. And here in Texas, under the TEKS, starting at grade 4, that's when there can be a conversation about, well, I'm just going to say it directly. Students, this is directly from the TEKS, learn about changes associated with adolescent development in the reproductive and sexual health strand. Subsequent grade level students identify the purpose of these changes and their role in fertilization and reproduction, and the students learn characteristics of healthy and unhealthy relationship and how to use communication and refusal skills to set personal boundaries in dating romantic relationships and how to respond to sexual harassment and abuse. Um, so do you have some ideas? At the end, you gave some thoughts in the areas that need to be written. Do you have like some um, sample IEP goals that we could use and incorporate it? And I'm thinking, what do you think as early as fourth grade or fifth grade and to propose this? And also, districts may say, well, we don't know that this person has that problem. I guess we may need to do a sexual knowledge assessment on the students. What are your thoughts about that?
Absolutely. And that's something I do. I do a sexual knowledge assessment. There are some really good ones out there. So yeah, definitely. And as far as IEP goals, I don't have any yet, but I mean, I'm happy to collaborate and put some together because I think that it would be imperative to do it. I mean, I think it needs to be individualized, obviously. But you've got the general education in the areas that are needed. And then also, for the ones where it's already reactionary, wanting to kind of go back and say, look, this wasn't provided and it wasn't provided adequately. So we now need to set some goals. But yeah, I mean, I'm happy to collaborate and put something together.
Lois, you have your hand up. Why don't you ask your question?
This is a fascinating topic. When I first read it, I kind of rolled my eyes, because we're in Texas and any type of sex education is going to be, political. But what's fascinating about this topic is, as a Texas advocate, we are getting 4-year-olds who masturbate in class, either closed or unclosed. And we tend to think of this topic with 12 and above. And we also forget that rubbing is a means of self what I'm my brain lost it, but self calming, and we have teachers who think it's just, oh my God, they're thinking of it as a 12-year-old and not thinking this is, for goodness sakes, it's a 4-year-old and they're just self-calming or they're just feeling and learning this stuff. When we're at home, right, we tell them, we'll go to the bathroom. It's, you've got all those things. But you're right, we don't teach kids when you have those issues or feelings. But I guess my point is, we are, as an advocate, we are already experiencing teachers with this complaint in pre-K. And they don't seem to be it's not so much of I look at schools and I go, you can't deal with a 4-year-old? Come on. But they can't. And the problem is, it's not the student or the parent. So much of the time we're dealing with the attitudes of teachers and schools who need this training almost more than a parent or a kid does, is what I was trying to get at. And I love what you're doing because um, it's so easy. You're so on target, and it was like a blessing to hear it. You're so on target with, they're so easily persuaded into situations that parents aren't prepared for, don't know what's going on. And then all of a sudden there are pictures being exchanged and oh my God, it's a legal issue.
Mhm.
I just want to know how to take your class and how to be a better advocate with this knowledge because I've heard about it for a long time. But having an occasional conversation from university professors who are working with ID kids who had a lesson about this 15 years ago to a brother-in-law who works in the ID community in housing provisions and having this issue. But what we never really hear about is how do we appropriately educate those who are actually in on the ground, parents, children, but more especially, how do we get teachers to understand this is not really. My son even worked in a lockdown unit, and their big issue was how gross it was that they had to take a student to masturbate. And I'm like, that's not gross. What was happening that this poor child had to go to that extreme to self-calm is more my concern. But we view it from our advocacy, and I would just, you're spot on. We don't think about this. And thank you for bringing the topic. And how do we I'm going to check out this area. Are there other books, information? How do we become better at helping students we're already experiencing?
Yeah, absolutely. Thank you. So you're absolutely right. If somebody has the method to educate teachers, I would be happy to do it. I've had a lot of like blocks anytime I've tried to approach the education system here in Texas. And so I just kind of stopped and went about doing other things where I know I could make more of a difference. But and going parent to parent or situation by situation. But it is, I mean, teachers really, they have to get comfortable with it, and administrators obviously too. But, they've got to get comfortable because it's happening. I mean, it's part of our natural human experience. And so it's going to happen, and we really need to address it because it is. I mean, I can't tell you, it's these cases are so sad. And we had one, adult who committed suicide because of it. And it's awful. I mean, it's just awful. And so we've got to get out there and prevent it. And I'm happy, Lois, to talk to you more, to have a conversation about how to get more knowledge and more exposure and to get the word out because, I've met with two people just this week and said, and well, three people actually, because I talked to Brian yesterday. But it's, this is a national thing. Like this has to be an us thing. This not just a me thing. This is an us thing. We as a nation have got to do a better job preparing individuals for what is going on throughout their lifetime because it is just awful how many people. I mean, we had a guy go to prison for life, another that 18 years old, and he approached his counselor with some things that were going on, and they didn't do anything about it. And then he ends up in prison for 12 years at the age of 19. Like yeah, we need to do a better job. And then, the MDRs as well. I mean, it's just we need to do a better job.
We need a,
There,
Somebody asked, go ahead.
I just want to say one more thing. We need a graphic of responsibility.
Mhm.
We tend to place it on the student, but we really need one that shows the school, the juvie system, or the adult legal system, parents. We need to all take responsibility and not, and we kind of need people's face to say, this isn't it isn't only them.
Mhm.
All of us are responsible to help the student along. And I just
Mhm.
wanted to propose a graphic like that should be what we're saying because we tend to
Mhm.
want to just blame the kid, like you said, and throw him in jail for 12 years or less.
Yep,
okay.
exactly.
So
Exactly. And it's true. Yeah, we do.
let me so we have just one more question. Just to Iris is saying, where would you put this under in an IEP? And we'll make that the last question and we'll take a little break before David comes back at about 11:05 or so. But if where's an appropriate place to have that conversation in an IEP meeting?
Yeah, I mean, I think that's a great question. I mean, my thing is under health, right? I mean, I think that's where I would put it. If it's somebody that also has like social skills, I mean, I could see it going under there as well, but I think health or social skills is where I would put it. Now, because again, the assumption, if we put it under behavioral, is that it's the child's fault and responsibility and they're doing something wrong. So I would put it under education, under health or social skills.
Yeah, and it's in the TEKS
Right.
under health anyway. But again, I just want to throw it to you. So to do an assessment, what would we call it? A sexual health assessment, or
Mhm.
that request that as part of an assessment that they should do?
Right.
Does that
I mean,
make
it's
sense?
the inventories are called sexual knowledge, but I don't know that the school would
Okay.
would be okay with that wording. So you'd have to like find the jargon that the school's going to be okay with. But yeah, I would say I want to know, you or even how about this? This is even better. Here are the TEKS. How much does the student know about those subjects that are in the TEKS? Because
There you go.
we do a star testing, we do all these other things. I want to know what they know of these TEKS that are laid out.
There you go.
And
Thank
I'd
you.
be happy to write that assessment measure to follow the TEKS and say, here's an assessment that follows TEKS that can be used to see whether somebody does or doesn't know that information.
That's the ticket. Okay, thank you so much, Michelle. We
Sure.
really appreciate the info today.